Hello, Healing Spot community. Today I am talking about what is pelvic floor physical therapy or pelvic physical therapy. And I want to first say I apologize for getting on late. I got back today from spring break and our flight got delayed a few hours, so this is the best I could do, but I'm here. And this week we're talking about pelvic floor physical therapy, and so we're going to start with this live video. I have my pelvis here. So I want to first start by talking about the pelvic floor, basically, and what its functions are, okay? So the pelvic floor is really the bottom of your pelvis, okay, where you sit on. If you're sitting, it's, just the sensations that you're getting through your pelvis from where you're sitting at, okay? So that's like the bottom. Think of it like the bottom of your back, basically, or the bottom of your core, okay? So its main function is to support and provide stability. It's also got the ability to control, like sphincteric control. It has sexual function as well as lymphatic, okay? So the ability to control the fluid in and out of the pelvis, okay? So those are the main functions. So when we look at the functions, then we can decide, okay, if there's a dysfunction in that, in the ability of the pelvic floor to do its jobs. If that doesn't happen, then there's a specialty form of physical therapy called pelvic floor physical therapy that addresses when things aren't working right, okay? So how would you know if your pelvic floor isn't working right? We're going to go over some scenarios and also just some diagnoses so that you can start to understand that maybe there's a little bit of help if you haven't been told this by a healthcare provider and you're suffering in silence. This is the main reason why I get on and do this education, because we talk about amongst our girlfriends maybe. Guys might, talk to their wives about pelvic floor dysfunction, but a lot of people are looking on the internet for information, or maybe they're getting some information hopefully from the practitioners, their providers, but not always. So this is why I want to do some education. So how would you know if you have some dysfunction in the pelvis? Okay, so you can imagine, I'm going to turn this around, but this is your spine stacked up. So I'm looking really at the pelvic bowl here. This bony structure of the pelvis makes kind of like a bowl or a ring, okay? So the bottom of it is the pelvic floor muscles, okay? And you can imagine, around through the front here is the lower abdominal muscles. Your back muscles come up through here. You have your hip muscles through this part, okay? So what you're not seeing here are the hip joint as the femur comes down, okay? So this would be the area you're sitting on right now, like this, okay? So what may you be experiencing if you're having pelvic floor dysfunction? So you might imagine having some pain at the coccyx, okay, or the sacrum, the triangle area. You might have heard of sacroiliac dysfunction or SI joint dysfunction or pain, lower back pain, all of that. You might know that you have some weakness in your core, okay, so along, kind of like around, okay. Pain in the hips, so pain that radiates into the groin area or like the crease when you're getting in and out of the tub or in and out of your car, when you're trying to sleep on your side, those kinds of issues, okay? So this can happen to men and women. I'm going to primarily address things that us women may be suffering from. So one thing could be pain from pregnancy, okay? So as this bony structure changes during pregnancy, you might get some pregnancy pains of the low back, the hips, the pubic symphysis here in the front where the hips or the pelvis meets up. It might be, like I mentioned, maybe some tailbone pain, some SI joint pain here, lower back discomfort. So pelvic floor physical therapists addresses pain with moms during pregnancy and also prepare moms for a smoother birth. So they may even address some pelvic floor issues. And, that's something that I check with my pregnant moms to make sure that they're ready for a vaginal birth, that the pelvic floor muscles have the ability not only to contract, but also to relax and allow for baby to come through that area. Some postpartum issues. So after baby is born, pelvic floor physical therapists address things like the open birth position or open birth pattern. If they've been trained by Lynn Schulte of the Institute for Birth Healing, as I have, we learn about the open birth pattern, that moms, their hips and their pelvis goes through certain movements to allow for baby to come on through the vaginal opening, and may even, depending, even if you've had a C-section, this can be changed, and you may be having some postpartum issues even if you didn't have a vaginal birth. Okay, so that's one thing that I check for as well, to make sure that all of this, the sacrum, the tailbone is moving correctly, the ilium are positioned correctly after birth. Okay. So some issues that moms might be having postpartum are pelvic pain, pelvic floor, in the pelvic floor, or even some strength issues. Okay, pelvic organ prolapse, so organs that can prolapse and actually descend down into the pelvic canal or pelvic outlet are the bladder, the uterus, or even the rectum, or a combination of any of those. Okay, pain with sex, that can happen from scarring, or even just some shifts that go on through the uterus and the cervix and things like that. Okay, leaking. So we talked about, one of the functions is the ability to control the sphincter's control. So, so leaking of bowel or bladder, incontinence, that's issues that pelvic floor physical therapists help people address and get over or improve. Core strengthening. Let's see, diastasis recti, so abdominal separation, which you can't really see here, but where the abdominal muscles from the front actually separate to allow for a growing baby. So we address core issues of the inner and outer core. Let's see, what else? So those are a lot of issues that can be addressed with pelvic floor dysfunction. I'm going to go over this screening tool. It's just 10 questions. I'm going to read them out really quickly. And if any of these, if you answer yes to any of these, in fact, if you answer 3 or more yeses to any of these statements, I want you to perhaps ask your provider for a referral to a pelvic floor physical therapist, or find one yourself. In most states, you do have direct access, so you can actually seek out a pelvic floor physical therapist without a doctor's order. And if you need help with that, please let me know. I'd be happy to direct you to some directories that I am familiar with, and can find you somebody in your area if you're not even local to me. I'd be happy to help. So I'm going to read these statements, and I want you to listen up. If you answer 3 or more yeses, I want you to look into this a little bit further, okay? So I sometimes have pelvic pain in the genitals, perineum, pubic or bladder area, or pain with urination that exceeds a 3 on a 1 to 10 pain scale, with 10 being the worst pain imaginable. I can remember falling onto my tailbone, lower back, or buttocks, even a long time ago, even in childhood. I sometimes experience 1 or more of the following urinary symptoms: accidental loss of urine, feeling unable to completely empty my bladder, having to go to the bathroom within a few minutes of a previous episode, pain or burning with urination, or difficulty starting or frequent stopping or starting of the urine stream. Okay, statement 4, I often or occasionally have to get up to urinate 2 or more times at night. I sometimes have a feeling of increased pelvic pressure or the sensation of my pelvic organs slipping down or falling out. I have a history of pain in my low back, hip, groin, or tailbone, or have had sciatica. Okay, I sometimes experience 1 or more of the following bowel symptoms: loss of bowel control, unable to completely empty my bowels, straining or pain with a bowel movement, or difficulty initiating a bowel movement. I sometimes experience pain or discomfort with sexual activity or intercourse. Sexual activity increases 1 or more of my other symptoms, or prolonged sitting increases my symptoms. Okay, so this is, like I said, if you answered 3 or more of those, I want you to seek out some help, okay, because the help is available. This is a screening tool that was designed by Dr. Nicole Kozian. It's called the Kozian Pelvic Dysfunction Screening Protocol. You can actually find this online, but again, if you want to just reach out to me, I can certainly share this with you. I'd be happy to, okay? So if you suspect that you maybe have some pelvic floor dysfunction and you want a little bit of help, reach out. I'd be happy to direct you in the right direction. Okay, ask your health provider, your OBGYN, your medical doctor, midwife, that kind of thing. Okay, and if you are a postpartum mom, I do have a checklist on my website. Okay, so it's a free download. You can go to my website, healingspotpt.com, and you can download this postpartum checklist. It's just a general guide that'll help you get started and steered in the right direction. Okay, so one last some parting information I just want to share with you. As a pelvic floor physical therapist, when somebody seeks out treatment from me, or they just want to know, how I might be able to help them, it just really starts with a phone call. Okay, so I talk to people on the phone, or I may do a discovery session, a free discovery session that I meet in person with people, and they get a chance to ask me questions. I get a chance to answer and educate them a little bit more. And then if they decide, hey, this is something I feel like I need some more help with, then what it entails with the physical therapy is it starts with filling out a health history, giving me some more information, some more details. I get a thorough history. It involves looking at things. So having somebody stand, looking at the alignment, checking strength of the pelvic floor, checking strength of the core muscles, the hip, the lower back, the abdomen, all of that. And then it may involve some manual physical therapy. So I do work externally around the hips and the low back, the lower abdomen, and then it may entail some internal pelvic floor work as well, where we actually go into the vaginal opening and check these pelvic floor muscles and check for the strength and check for where these organs are. Okay, so it's not any more invasive than a well woman exam, and I would educate before we do anything, and that's always up to the woman as well, if she wants to do any kind of internal work. It's not, we don't have to, but it's definitely part of treatment. And as I tell my women, it's more comprehensive to do the internal work as well. It also involves maybe some exercise, so strengthening, stretching, and as well as education. So that's it in a nutshell. So if you have any questions, please reach out to me. I'm here to answer them, and I hope this was informative. Thank you very much. Talk to you soon.